Hi guys, my name is Harpreet. I'm a registered nurse and a nursing coach working in BC, Canada. Today I thought I would just come up here and update you guys about this very huge change, which we will be seeing in the beginning of next year from January 4th, 2022, the introduction of a new licensure exam for the practical nurses in the provinces of BC and Ontario. So from the traditional CPNRE, we will be moving or transitioning into a new exam, which will be called as RExPN or RExPN, whatever you guys wish to call it. The full form of this exam is Regulatory Exam Practical Nurse. This one is going to be very different from the CPNRE exam, which we have done already, we've been doing so far. And yeah, there's just one more window left for if you wish to appear for CPNRE. But if you will be taking your exam next year, this video will be highly helpful. I'm sure this is just an effort. And this is not anything which is in details, but just a brief overview to help you guys understand the basics of this exam. So without further ado, let's get into it. So first of all, what is RExPN? So as I already mentioned to you, this one is the new licensure exam for licensed practical nurses. That's what we call them here in BC. And if you are going to be taking the exam for Ontario, you will be taking it to become a registered practical nurse. Now, this exam is very different from CPNRE because this one is a computer adaptive exam, a CAT exam, computer adaptive test. That's what they exactly call it. So this one will be very similar to NCLEX, and I will make sure to put down a link in the description box to another video, which was developed by NCSBN, who are the developers of this exam as well, in order to make you understand what computer adaptive testing would mean. So here, this computer is basically looking at the number of items you're making correct, you're making wrong. So, and then based on your correct or your wrong answers, they are deciding your difficulty, the difficulty level of next question. So let's say that you had a very easy question, you got it right. Then the following question is going to be a little more difficult. If you are able to get that question's answer correct, then the following question will be even more difficult. So your job during these types of testings is to reach that level of difficulty. And just in case if in between you have a wrong answer, then the following question will be of a little lesser difficulty level. So this is how the computer will decide if you are able to meet those entry to practice or entry level competencies, which you will need when you will start working as practical nurses in future. Then the number of questions, the number of items is technically the number of questions. So you will receive a minimum of 90 questions. So your computer might shut down at a minimum of 90 questions. Or you might have to go as many as 150 questions in total. Out of these 90 and 150, you will see that 30 questions are pre-test items, but as people taking exam, we would not know which questions are pre-test because they're not scored. So which one has to be scored, which one doesn't have to be scored. So we will not technically know, but out of 90, you will have 60 questions on the basis of which you will receive your test results. And then on the higher side, it will be 120 questions in total. And in order to do these many questions, you have 4 hours. Now, this is where the catch is, where this exam might prove a little less challenging in terms of time management, which was the problem for a lot of students during CPNRE, because you had 4 hours to do around 165 to 75 questions. But here, the number of questions might not be as many, right? Here, when they are testing you on the basis of RExPN or RExPN, they're testing your entry level skills, your knowledge, which you need at the entry level, and also your judgment. So these skills, knowledge, judgment, as nurses, you must know these things at the beginning of your career. So there won't be any testing based on advanced skills, specialty knowledge, or judgment in relationship to very complex situations. Here we are talking about entry level nurses, entry to practice. So your CNO, BCCNM competencies would definitely come in handy here. Okay, now this one is the test plan, and this looks very similar to the NCSBN's NCLEX RN plan. Now, as you see that this little pie chart, it shows us the major areas as to which they will be developing your test. So for example, we have management of care, which has a lot of questions, like 21% of this test will be based on the management of care. So you need to know a lot of, nursing care related to the diseased conditions, your prioritization, those kind of things are really important here. Then followed by that, safety and infection control. So if you're not able to keep your patients safe, it would be an issue, right? But if you look at the other side, where we have pharmacological and parenteral therapies, so it constitutes around 17%. So in this test, we might have to go a little bit in depth in terms of pharmacology. We might have to know about more drugs than we used to study for the CPNRE exam. Then the rest of them are about risk reduction, where a lot of health teachings is involved. So for example, crutches, canes, walkers. Why do we study them? We study them because we don't want our patients to get injured. We don't want them to have fall. We don't want them to have nerve injuries. So this is where your risk reduction kind of topics fall into this category. Then basic care, comfort, physiological adaptations, psychosocial integrity, and health promotion and maintenance. Like they're pretty much covering the same amount. But as you can see, health promotion and management, also maintenance, also covers a lot of teachings. So it's just 9%, right? So it's not a big deal. Like teachings is not a big part of the exam, whereas nursing management, your pharmacology, your safety and infection control, they cover a lot more as compared to this one. So just make sure that you study your systems based on this test plan. In my forthcoming videos, I would try to break it down. I did not want to have just one video with everything. Things get really boring in 1 hour videos. And so I wanted to just give you an overview in this one. It's just one part of it. So these are some basic things which you should know. I would say you must know. Now, the good thing about exams like RExPN is we have unlimited attempts. So this is a good news for those people as well who have exhausted all the 3 attempts of their CPNRE exam and could not succeed. So they could also, use RExPN as their new exam and could really do well here. Then there will not be any windows. We will not have to wait for our window to be here, and then we can only take the exam. It's available throughout the year at all the Pearson VUE centers around the world. So you could be anywhere in the world and you can take this exam. Then just in case if a student is not able to be successful in their first attempt and they want to take another exam, there will be a little longer wait period. So you have to wait for 60 days, which is 2 months in between your 2 attempts. And then this here on this exam, they're never going to test you about any knowledge on the system, healthcare technologies, any history, any government regulations, laws, or even cultural issues, because they would vary from one regulatory body to another. So I was going through the CNO's website, and I would definitely leave the link in my description box for you guys to go over yourself. That every regulatory body has their own way of testing these things. So for example, we have jurisprudence exams in CNO, and we have a similar exam here in BC as well. So those are the exams where they can test your knowledge about all these things. But for the RExPN, the test plan, whatever we discussed in the last slide. That's what they will be testing you on. And the last thing is there will be questions on lab values. So this is a little different from your CPNR exam where you never had to study lab values because they never tested you on those. But if you look at the NCSBN RExPN's test plan, you would see that they have given you a bunch of lab values, which you must know. And I would be going over those. So these are some of the things which are new. They say that they would be testing people on medications more specifically, but they will not be relaying any list of medications. So we would be definitely going over the medications as we go during the systems. So as we read respiratory system, we'll go over those meds, we'll go over COPD meds, asthma meds, pneumonia meds as we go. So that's an easier way to kind of go over your pharmacology lessons. Yeah. So all the task statements in the 2022 RExPN test plan, they require the nurses to apply all the fundamental principles of clinical decision-making and critical thinking to nursing practice. So there will not be any kind of questions where they're directly testing your knowledge. If you have such a question, you know that you might not be doing very well. So as we go further, I would be talking more about the CAT type of examinations. So I'm not expecting any questions which are really very straightforward decision making, but yes, I am expecting questions where I will be utilizing all my critical thinking. I would be using my content to apply to those questions. So that's what is our basic goal. And definitely we are, as nurses, we are always expected to know about other concepts other than just the healthcare. We must know about the social, biological, and physical sciences as well. So this is another assumption from the test plan, which definitely you guys go over whenever you're reviewing this content or you're studying your PN programs in your schools. So yeah, so this is the big thing about RExPN. And going back, so this is CAT exam. There will be 90 to 150 items and you'll be sitting down for 4 hours. And then we have unlimited attempts, a wait of 60 days in between these 2 attempts. But the only thing which is important to know is that it's just BC and Ontario which will be adopting this test next year. We have a new CPNRE test plan until 2026. So we might not see this test in other provinces. However, if you are an internationally educated nurse, BC and Ontario are the big provinces where we see our students taking their exam for. So yeah, so this is all about the basics of RExPN. I hope this video would help you. These are all the references from where this information was taken, and I thank all my references. So yeah, thank you very much, and subscribe for more videos on RExPN and NCLEX. Thank you guys. Thank you for watching.